Hey everybody, it's Jessica DeMassa with What's the Future Health. We are talking to the who's who of health tech and healthcare innovation. And today, thanks to one of our great sponsors, Bayer G4A, we get to have a special guest on who is speaking at their event, which takes place on September 9th, their digital health event, Digital Health for All event. We get to talk to a serial digital health entrepreneur, a behavior change scientist, oh yes, and the VP of Direct to Consumer at Optum. So Kate Wolin, Dr. Kate Wolin, it's very nice to have you here. Thanks so much for joining us.
It's a pleasure. I'm really excited to get to talk with you.
I'm very excited to talk to you too, because I have followed you along on Twitter for a very long time. And I love the fact that you identify more than anything as a behavior change scientist. And I feel like in a number of interviews that I've done this year, this topic seems to be coming up over and over again. And those collections of words to describe what's going on seem to be new in terms of what they're being applied to. Maybe not to you, but to me. So what I'm hoping for is that you can help us unpack this and understand what's going on in behavior change science, because I'm not sure everybody is up to speed on what this discipline is and how it is being used in healthcare today. So let's kick off here. So, I mean, you have been involved, like I said, a digital health entrepreneur in your role at Optum. You're doing a lot of things where you're talking about behavior change science, but what are some of the big misconceptions about this as a discipline? Like I said, I'm not sure people even know what it is. So start there for us.
Yeah. I mean, I think one is that it's new, right? So I've been, make myself sound old. Awesome. I've been doing this my entire career. My first job out of college was in behavior change science. And, I look at it, and the Society of Behavioral Medicine, which is the academic home of behavior change scientists, was founded in 1978. So when you think about, there were enough people that had been doing research in this long enough to found an association in 1978 means we've had this scientific discipline for a long time, right? And that makes sense when you think about, take the DPP, for example. Mm-hmm. We wouldn't have funded the DPP. NIH isn't flush with cash. They're not minting it, right? So they're not going to fund the DPP unless they're confident that there is enough science that this will likely be successful. So there was decades of behavior change science before the DPP was launched, and the DPP was launched quite a while ago. So I think that's one. I think the other is that people often confuse behavioral science or behavior change science or behavioral medicine with behavioral health or mental health, and two totally different things, right? Mm-hmm. So, behavior change science is, where I trained in it was at the intersection of health psychology, epidemiology, and biostats. So having that data analytics part of it, having the health psychology rigor, the study design rigor that comes from epidemiology. We also see a lot of behavior change scientists coming out of the behavioral economics space. So depending on, and we hear a lot about behavioral science outside of healthcare, right? So in finance and other sectors too. So I think, those are two of the ones that I hear about a lot. I think the one that frustrates me the most is when behavioral science gets reduced to a formula or a couple of bubbles and arrows on a slide. Okay. And the way I kind of think about it or explain it to folks is, I might know that our revenue minus our expenses are our profits. That doesn't mean you're going to hire me to be your CFO, right? Like my understanding of physics in thrust and mass and whatnot does not mean you're going to hire me to be your aerospace engineer, right? So there are in lots of places in our lives where we might know the fundamental formula underneath it, but how you bring that formula to life in an applied setting to drive the engagement and the outcomes that you want to see, that does require experience and expertise. And there are a lot of folks out there who have it.
All right. You started out by talking about the diabetes prevention program, the DPP. And I feel like in this space where I keep hearing it most is in this whole chronic condition management space. Yes. So it's either diabetes prevention, diabetes, sometimes it's related to weight loss. Sometimes it's related to getting more exercise. Sometimes it's related to all of the above. Sometimes it is put into a mental health context. So I'm curious to know from your vantage point, when you're looking at what's going on in the industry, particularly in this year of digital health, right? I'm curious, how do you think we're doing in terms of integrating behavior change science into what we're trying to do in terms of providing these digital solutions for some of these, really challenging disease areas that are that stem from a behavioral kind of pattern in the first place? How do you think we're doing as digital health in terms of integrating behavioral change science? Like, be honest with us, Kate, because I want to hear what your thoughts are in terms of what we're doing right and also where we could improve, like where we might be missing the mark and could do better.
I think we are doing better than we used to. In part, we're having the conversation, right? It's getting surfaced more. We're having conversations where, more and more I'm hearing people saying, do you know anyone who knows about this, right? And it's not just related to chronic conditions. We see it in medication adherence, right? In HIV care, right? So, you can apply behavioral science to a lot of aspects of healthcare. And I think we're seeing an increase because that expertise is being tapped into, the sophistication with which it's being applied is growing. So when I look, my training tells me there are close to 100 behavior change techniques. That means we have a lot of tools in our toolbox as behavioral scientists. And what we learn through that experience is that in different contexts for different conditions, some of those tools are more or less helpful. And so we're able to leverage them. I might use different tools to get someone to do a flu shot, which is a one-time endeavor, than to get someone to engage day after day in their exercise or weight management regimen. Because, I'm a public health person by training. My goal is not to get you to lose weight for 3 months and gain it back. My goal is to get you to lose weight over 3 to 6 months and keep it off on and on and on, right? And so that means I have to bring some tools to the table to get you to initiate the behavior change, and a different set of tools to the table to get you to continue to adhere to the skills and behaviors that you've learned over the course of the program. And I think what gives me optimism is that the field is getting better at leveraging the full set of tools in our toolbox instead of just relying on one or two that they may have heard tossed around.
All right, I'm gonna put you on the spot. Is there any place where you feel like we could improve collectively? Like anywhere where we are just like completely missing the mark? Are we doing okay?
Yeah, I think the one that I find a little frustrating is I think we over rely on nudges. And I think we often don't define what we're trying to do or what we mean by a nudge. And so it's not that I don't like nudges and don't think that they have a
read that you don't like how it's being applied. I was like, ooh, we have to jump into this. So, okay, yeah, explain to like tell us your frustration with the word nudges. I'd like to hear that.
I think too often it gets held out there as a panacea, right? And so I think of it the way I explained it to one of the software developers I worked at, is sort of like someone being like, well, we'll just nudge them, is like a product person coming to you and going, well, can't you just put a button there? Right? Like it's, it's a little more complicated than that. Right. And I think particularly in the case of chronic diseases, what we see in the science is that, when people have powerful motivators to do something, you can't nudge them out of it. And we also know, how many of us have been nudged with reminders from an app?
And you just turn it off.
We tune them out, right? And so I think it's the context that they're happening in, how motivated I am, how engaged I am, are all going to change my receptivity to that nudge. And so I think it's making sure that the nudges are used in a broader context. What is the theory of behavior change that we're using? How do we understand the motivation of the patient? And then thinking about using nudges in a very purposeful way instead of saying like, that I have a hammer, everything's a nail.
All right, I want to hear about technology and the role that that's playing in this, because you had said earlier, it's like there's like 100 or so different tools in your toolbox as a behavior change scientist. And you said the discipline started a long time ago, far enough ago where having a smartphone wasn't even a thing. So I'm curious to hear your thoughts about how technology is being used effectively, and where it might be like we're getting overly nudged, might be a place of frustration. Like we have to be a little bit more mindful of it, but like, where is technology working in terms of helping with behavior change science, in terms of like just helping I guess, adapt the field and helping make, bigger improvement and making bigger impact and outcomes, like you said, when it comes to people's health?
Yeah, so I'll use a specific example from my work. And so I started out working on those sort of core prevention behaviors: smoking cessation, diet, activity, weight management. And when I started, we were at like kind of web 1.0 or even before that in what we were doing. So we would give people in our weight management interventions a little notepad and a Calorie King book, which, was this. And so you would tell people, write down everything that you ate, write down your exercise, and then go flip through the Calorie King book, right?
Look, and then get your abacus out and add it up.
It required numeracy and literacy skills that talk about friction in your experience, time consuming, right? So and yet we did it because self-monitoring is a cornerstone of behavior change. And we have known that for so long, and particularly so in weight management. But what we would find is, about 2 weeks in, you would see people in the parking lot, right, in their car, filling in that sheet before they came in for the group, coaching session. And so, there was a lot of excitement when technology became available in terms of fitness wearables and rocking that Palm Trio to start doing your self-monitoring, right? And then then we put it all in one in a smartphone, and the country continues to stay sedentary, and the country gets heavier and heavier. And so I think it's like, wow, like, these tools have the ability to reduce friction, but they're not sufficient. And so, when we Scale Down was my first startup, and it was based on the science of daily weighing and self-regulation that came out of my colleague's academic lab at Duke. And we gave everyone a connected scale, like very first generation that was on the market. And and so you sort of had this, right? Like, okay, like now we have a connected scale, hand it to everyone. Is that sufficient? Like, we've had scales in our bathrooms for years. It's not sufficient to hand someone a fancy piece of technology. It's what you do with that matters. And I think, sort of thinking to another misconception is, if we just show people their data, they're going to know what to do, right? Like, here's a brochure. If I tell you what to eat, you'll just, we've known that these things have limited lift for a long time. But what we were able to do is to take that data in, along with other information that we gathered about the person, and provide just-in-time personalized feedback, right? So we were engaging them in a high frequency basis. And so we were leveraging that technology as a means of engagement and as a means of personalization. And so I think that's the kind of thing where technology adds value when you're using it in that setting. Are we using the technology to provide insights to our clinicians or our coaches or whatever context we're in? Then I think it has opportunity for us to reach people in ways we couldn't before. So, you think about, I hate to reduce humans to housebreaking a puppy, right? But when you're housebreaking a dog, right, you don't give them feedback on peeing in the house a week later. But that's historically a lot of what we've done in providing feedback to people about behavior change. So technology provides us with a lot of opportunity to engage people in real time. We just have to do it in a way that taps into the nuance, the context that they live in, their preferences and their motivations.
I want to talk specifically about personalization in this, because I think this is interesting. So I've read that is like one of those tools in that toolbox, is to be very personalized. Is the technology version of personalization? Like, I think about like Amazon, where it will like, it collects my data and it'll recommend things that I might like based on what other users are getting. Is that kind of personalization enough for me to make a significant change in my behavior as it's related to my health? Or do I need like the personal support of a person? Because I feel like, especially too, it's like a lot of these digital health startups, they've got wrapped around their solution the one-on-one support of some sort of a health coach, or somebody there, a nurse or a doctor, a clinician, somebody who can help provide person-to-person feedback. And it's been interesting to me that even though that might be delivered, via like telehealth, or like it'll be delivered virtually, the contact with a person is still very much a part of their digital health solution. And they've got the other technology piece there with the insights and the analytics and all of that. So tell me your take on it. Like, can we ever get away from the personal support piece of this? Like, will technology ever suffice in terms of personalizing enough, or what do you think?
This is one of my favorite questions, because I founded a company that had zero human support,
Okay.
and so my first startup, that digital weight management solution, we had no coaching whatsoever. In part because we
had your calorie book.
We were trying to complement, right, their clinician relationship and not disintermediate it. But what was always hilarious to me about that is our founding team of scientists, if you asked any one of us, we would say over and over again, every single bit of research says that solutions work better and the outcomes are better when you marry digital and human. Okay. Every single time it's been studied, you get better outcomes when you add a human.
Why do you think that is, Kate? Like, what does the research say, or what do you think?
So I think there's a couple elements of it. I think that personalization is a word that means a lot of different things. And so when we study it, there's kind of a lot to unpack there, right? In some contexts, personalization could mean you and I each get something in the mail that says flu season is coming, go get your flu vaccine, and yours says, Dear Jessica, and mine says, Dear Kathleen. Like, that would count as personalized in some settings, right? Both in the academic literature and in some Silicon Valley pitch decks. So, there's a wide range of what that can mean. And I think what we don't yet understand in the academic setting, it hasn't been, we're still starting to publish it. And I think in the challenge with the digital health world is that would be considered, IP. And so people don't reveal it, is what is the active ingredient? And so we're starting to get this with some new types of studies in the academic literature where they actually do optimization trials to understand, like, take something like the DPP, right? There's a human component to the DPP. There's educational content, there's self-monitoring. No one's ever said, what if we took one of those away? Side by side, take this away, what would be the impact? And there might be situations where taking the human away does lead to a slight reduction in weight loss. But the weight loss reduction is so small and the cost of the human is so great that in certain settings, that makes for cost-effective intervention, right? We really haven't unpacked that in a lot of ways. And so I think personalization is very sexy right now. And that's great. And I think there's value in it because, but one of the things I think is interesting is some of the research has indicated that perceived personalization may matter more than actual personalization.
Okay, perceived personalization. Tell us what that is.
So you and I believing that we're getting a highly individualized experience, and we might be getting the exact same content every single day.
Okay.
Right. But I believe that this program knows me. Right. And that can be true in digital or health coaching. I think there is a lot of times a perception. I'm going to use the DPP again as an example. It's a curriculum, right? Like, the DPP is not cognitive behavioral therapy where we're doing this like intense one-on-one relationship. Like, the DPP, as originally written, is a curriculum. So think of it as the difference between sitting in a lecture hall, right, for like intro biology in college and having, or intro physics, right, versus having like Carl, Sagan like tutoring you in physics, right? Like, I think people think it's like, I'm getting this intense tutoring with Bill Nye the Science Guy. And in fact, you're getting like, the person who, like, the TA for the fancy professor who's leading your intro bio section, right? So, I mean, that, I don't mean to make it sound like I don't think highly of the DPP, and I do. But I think that, it's important that people, and that perceived personalization can actually be what drives engagement, even if it doesn't drive outcomes. So there's some great work by my colleague, Heather Cole-Lewis, where she distinguishes between engagement with the solution or the program or the app and engagement in the desired health behavior that's going to lead to the outcome, right? And if I never open the app, I'm not going to engage in the physical activity the app is trying to promote. So they both matter. But so sometimes that perceived personalization may matter more for app engagement than health behavior change.
That's so interesting to me. I think it's so interesting because it's like health is so personal. And so it's like this whole idea of like perceived personalization versus true personalization. And then like, I love what you just said too. It's like the behavior that you want through the app or the changed health behavior.
Yeah.
You figured that out, Kate?
Like 72 times a day.
I love that. So I want to pivot a little bit and I want to ask, we had said at the top, you're a serial entrepreneur, but behavior change scientist. And it's like, that's what you're drawing from through this whole conversation, which to me is fascinating. But I've got to say, I don't run into a lot of startups, particularly the small ones that are scaling, that have a behavior change scientist on their roster. And so I know you're also a big proponent of, building multidisciplinary teams and, the whole idea of cross-pollinating, different ideas and different backgrounds to help, do this stuff in healthcare. And I don't know if we necessarily see enough of it. I mean, I feel like it's just even new that we've got like technologists to come into the healthcare space. I mean, it's been so driven by other things, by clinicians and by more of a medical background that now it's like you've got all of a sudden technologists and products people and a whole cadre of individuals that have a very different skill set. But behavior change scientists, how do we find those? And like, if you're a startup, can you give us some advice? Like, when should you start looking for somebody like that? Like, how early on, like, I mean, are you talking like series A, series, you know what I'm saying? Where you're like, this is a key person in our team that can help with product design. Like, how early do you find them? Where do you find them? Like, help us out here.
I think it's like asking us, an accountant, like how early should you engage an accountant? And they'll be like, the day when you found the company, and I think, I do think it also, I think depends on, how critical is behavior change to your company. And I think folks like the team at M Disrupt are really pushing that if you're a healthcare startup and you don't have a clinician, you're doing medical stuff and you don't have a clinician on your team, like, hold up, reel it back, right? Find that person. And it doesn't mean they have to be a full-time employee. But I think what we see a lot are, scientific advisor, having a conversation, and that is far more affordable in your early stages. And then obviously, right, in the same way that, at some point you hire an accountant instead of doing your own books. And then you always realize you should have hired them earlier. I think it's a similar thing around healthcare expertise at a startup, right? Whether that's a clinician, if you're a nutrition startup, you should have a dietitian on your team, right? And so I think of it in that same kind of way about thinking about, and you don't have to, I think, if you're hitting your Series B round and you think behavior change is central to your company, you don't have a behavior change scientist on your team, like maybe reconsider that. And part of it is, if you hire well, that person will add value, I think, in a lot of ways, right? It'll add value in your product organization. It adds value in your conversations with the market to help the market understand what you're doing. And I mean, look, in the market that we're in, the ability to show that what you do works is important, right? We want to be able to show that we're achieving the outcomes that we came into this space to deliver. And having a scientist on your team is helpful for that.
How do you find them? Okay, I'm going to go back to that because, like, truly, I feel like I can hear the sound of 1,000 digital health founders Googling this right now. Like, behavior change scientists, like, hi, how do you find somebody like this? Like, and are there other things that somebody would look up in order to get at this person?
I think it depends if you're looking for someone to be an employee versus someone to be on your scientific advisory board, right? So, if you're looking for a scientific advisor, hiring an academic on an hourly basis who's published in your field can be a great way to understand the science more, right? Get your product team, your engineering team aligned. I've seen that done a number of times, and is a great way when you can't hire someone full time. And there's a lot of those folks out there. The Society of Behavioral Medicine that I mentioned earlier is home to a lot of academic and non-academic, folks in industry, scientists. The other, I mean, truly, it's a lot of networking is what I found, right? People who understand product development, who understand, because we all operate with constraints, right? Academics operate with constraints, startups operate with constraints. So someone who understands your constraints is often a bonus. And so what I often get asked is, do you know someone who knows behavioral science and understands that we don't have $5 million to run a randomized clinical trial like you do in academia? So how do you balance those things? And that happens a lot through referrals. So I think of like, Kevin O'Leary's Health Tech Nerds, like those kind of groups where people ask around and say, me too, ask around for advice. It's the same kind of thing, right? Does someone know someone who can explain EHR APIs, right? Does someone know someone who can explain behavioral science, right? It's the same. Right. I think of it the same kind of endeavor as like, how can I tap into that?
Do you think they have to have a healthcare background and behavioral science, or can they be like a behavioral science person who's worked in another industry? Because I would imagine behavioral science would extend, cross discipline, right? Cross industry. So like you probably have them in retail, you probably have them in all sorts of things. Working at casinos, like who knows? But, you know what I mean? Like, do you have to have a healthcare specific one, or are the principles so the same that they would be insightful, even though they'd be applying those concepts in a healthcare environment?
The techniques are the same, but we don't call healthcare the double black diamond of entrepreneurship for nothing, right? And health behavior change, it is different because we're talking about these chronic conditions where we want someone to do something over and over again. And I also think, I trained as an epidemiologist in the chronic disease space, right? There were lots of things that we thought in, early in my training. We looked at the observational data. We said, like physiologically, it would make sense that if we gave people this supplement, we would reduce the risk of cancer. And we ran the trial. And in fact, some types of cancer risk were increased, right? So this is the place where someone who's been around healthcare and understands that things don't always play out how we were hoping, and that every intervention doesn't quite go according to theory. Someone who's been around that a few times and knows that literature is probably helpful. I think the other thing is they're just familiar with the literature. So when you ask them a question, their ability to get you the answer quickly is different because they know the literature, they know where to look.
I love that. No, thank you very much for clarifying that too, because I'm not sure how you'd find one and then which specific one you need. I think that's awesome. Yeah. So what do you see as happening next in this space? Like I said, I feel like I keep hearing behavior change. Behavior is like, it's become a thing now. And so like, what do you have your eye on? Like, where is this space headed next couple of years, you think?
What I really am enjoying watching is we're still seeing a lot of point solutions, right, that really focus on someone's specific need. But I love the conversation too around platforms. And when I look as a chronic disease person across a lot of conditions, right, the behaviors are often the same, right? Eat fruits and vegetables, move more than you sit, right? And the behavior change techniques that we use for those health behaviors are often very similar, right? Time management, problem solving, navigating setbacks, building social support. So if you think about behavior change as having those techniques as Legos, how we combine them together to meet people where they are. And I think that, those platforms have a really unique opportunity to do that. And really meet, because, today I might be stressed and I'm not ready to quit smoking, but if you help me manage my stress, I might be ready to quit smoking later, but then stress is going to pop back up and you're still there to help me manage my stress, right? Because it is an ongoing process. And so our ability to keep people engaged, I think allows us to drive to those long-term outcomes in a really meaningful way.
That's awesome. Well, Dr. Kate Wolin, it is a pleasure to speak with you and to dive deep into this. And for anybody who's interested in hearing more from her, you should definitely tune in to this Bayer G4A event. It's called Health for All, a digital health forum, and is airing September 9th. You're on a panel, right, Kate?
I am.
An illustrious panel of
An
experts.
illustrious panel indeed.
Star-studded.
Yeah, people I learn a lot from in those kind of panels.
I love that. I think that's great. And I think, I mean, you guys are talking, I believe, about design thinking and this whole idea of using behavior change science in terms of helping generate good health, like impacts and good health outcomes. So more in that conversation, plus some added perspectives around her. So go check that out. You can find all the details over on the website. It's G4A.health. So the number 4A.health. You can check that out there. And I believe you need to register for it. So definitely do that before the time comes, but I do think it is free. So we love that. We love that. And then, yeah, thank you to you, lady.
Thank you.
It's good to speak with you and good to pick your brain. We'll have to have you stop by, particularly as time goes on and we see more of these companies take on this more sophisticated adoption of some of the science that you've been doing for such a long time. So we'd love to hear more from you. You'll have to come back, please.
Be my pleasure. Thank you.
All right, Dr. Kate Wolin, thank you so much for joining us. I'm Jessica DeMassa. For more from the who's who of health tech, please check out my YouTube channel. It is youtube.com/WTF Health. We'll talk to you guys real soon. Dr. Kate, take care. We'll see you.